Hi everyone, my name is Steve. I'm from IMA, Idaho Medical Academy. Hi everyone, back again here to talk about the order of draw. The purpose of the order of draw, why there's different categories, is to prevent cross-contamination between tubes and bottles. The tubes and bottles all have additives. The additives either help promote changes or prevent changes. And usually they're referring to as clotting. Okay, the order of draw with the blood cultures, the purpose of these is to recover pathogens within the bloodstream. We have two different types of bottles. We have aerobic, anaerobic. Aerobic can have air. Anaerobic means the absence of air. So they're looking for pathogens that grow in each environment. So when you have, when a physician orders blood culture bottles in sets, the sets usually consist of both bottles because the person is not diagnosed yet. Usually we call that a FUO, fever of unknown origin, why the physician would order these tests. When you have both bottles, you're going to usually be doing it with a thing called a butterfly, a winged infusion set, aka the butterfly. With the butterfly, because there's air within the tubing here, the first bottle that I would attempt to fill would be the aerobic bottle. Then I would go off to the anaerobic bottle to expel the air before I went to the bottle that cannot have air. With these bottles, they have a thing called a vacuum, negative pressure in them, like all the tubes do. So with these, there's a certain, let's say, special way to prep the site. With blood cultures, we're trying to do a sterile or near sterile type of collection. Obviously, we can't make it totally sterile, but what we're going to try to do is we're going to clean it with the alcohol prep. We're going to also then use either iodine, which has been faded out. More likely, it's going to be chlorhexidine gluconate. And we're going to clean about 2 to 3 inches beyond the puncture site. We're going to make sure that let dry, has to fully dry. During this time when it's drying, we do not want to tie the tourniquet, repalpate, or tie the tourniquet and have it touch or repalpate the site. If doing so, what you're going to do is transfer whatever's on your gloves, whatever's on your tourniquet onto the site, and that's going to cause a false positive result, meaning you're going to get a positive result for something that's not actually within their bloodstream. So we want to be very cautious about this. So again, you're going to most likely use the wing infusion, the butterfly set. Another fashion of collecting it is with a syringe set. We pull the blood. You would then put on a female transfer device, and you would go up and we go and boom, put a certain amount of blood into this one, and then a certain amount of blood into the next bottle. So different ways you can collect it. The most common way is with the wing infusion set. With the blood culture bottles, the whole thing with this is the liquid in here is called a broth. So this one is straight broth, it's just a liquid. This is typically you have used when a person is not on antibiotics. So you have an aerobic and anaerobic bottle with just broth for that type of scenario. Then we have this one in which there is little floaties. It looks like a snow globe. This is for when a person is on antibiotics. This is a resin. So you have broth by itself, aerobic, anaerobic. You have broth with resin, aerobic, anaerobic for both types of scenarios. As the person's being diagnosed, once they get the results back, if something grows in one of the bottles versus the aerobic or the anaerobic, future draws, they're going to eliminate the bottle that did not grow anything, and they're going to stay focused on what grew in what bottle for future testing. That allows them to get the right antibiotics on board and treat the patient like we need them to be treated. These samples always get sent off to microbiology for processing. They have to incubate for a time before they can actually get a final result. We usually don't go with a final result or a diagnosis until we've drawn twice. 2 samples, collect from 2 separate areas in order to get the diagnosis that we're looking for. And that's to rule out mistakes. So again, we have aerobic, anaerobic, fever of unknown origin. These are done first to avoid any type of cross-contamination. Second in the order of draw. And with all tubes and bottles and tubes, the additive, the chemicals inside of them have to be mixed with the blood that we're putting into the container, the cylinder. We call that inverting. With inverting, we want to go with a generic number of 5 to 10 times. It would be legit enough to go with generic. And that's simply a figure 8 infinity sign. That way it thoroughly mixes with the chemical, which allows it to either prevent it from clotting, binds the calcium like this tube does, or promote clotting in the right time frame we need it to. Okay, first tube in the order of draw, tube-wise, is light blue. Light blue is in a bunch of different types of scenarios. In a hospital, before you have surgery, they might draw this tube to see if you're going to bleed out all of the table. Your clotting factor is what this is looking for. Also, maybe after surgery, to make sure you don't throw a clot. That's not good. That's bad. And then we also have people that are on blood thinners. So in outpatient laboratories, patients will come in and they say they're taking blood thinners, and they want to make sure that the medication is working or not working too much. So they'll come in, and they're usually have a thing called standing orders, where they come in, you get to know them by name, their family, their dogs, and so forth. But you get to know them because they're coming in once a month, maybe once every 2 weeks at the beginning, to make sure we're checking their blood levels. And that'd be their therapeutic drug levels. So with the light blue tube, the reason why this one is before any of these other colors is, again, the cross-contamination of the chemical additive. So with light blue, what stands out the most with this one is there's different ways and different fashions to collect the blood. You can either use the ETS, evacuated tube system, which is probably the most common that you encounter or you would see in an outpatient type of setting. We go in, push our tube on, boom, allow it to fill. Another fashion, another way would be with, again, the butterfly, the wing infusion. With the wing infusion, though, there's one thing I need you to keep in mind. So this particular tube needs to be filled up to a certain thing called a ratio. This ratio is called a 9-to-1 ratio. There's usually markers on the tubes or bands that will tell you where this line is. It has to hit that line. It will not overfill. The vacuum, the negative pressure is preset, so it'll fill up to whatever is needed. But we can underfill it, and we want to avoid that because then they'll have to discard the sample. So with the light blue tube, if I chose the wing infusion set, the butterfly, if this was my first tube that I was going to draw, boom, I will go in on my patient and I push my tube on, blood flows in, we think it's all good. No, because we have the air within this tubing, which would now take up space inside the tube, which then would allow the tube would only fill approximately there, which would be short. How do we avoid this situation? Book-wise, perfect-wise, we want to grab a tube with no chemical additive, like a red glass or a red plastic with no chemical additive. That way there's no cross-contamination. And what we want to do is pretty much just get the air out of the line. We push the tube on, we can get one drop, simply one drop. Take that tube off, and what we're going to do is discard this. Don't tell the patient this, they'll get mad. But we're going to discard that one tube. Now I place my light blue tube on, boom. It's going to now fill up to the correct level that it needs to. Again, we want to make sure we invert it after the draw. This tube goes off to a department called the coagulation department. It's housed within the hematology department. Again, 9-to-1 ratio is a key factor with it. The chemical additive is sodium citrate. The sodium citrate, what it does to the blood is it binds the calcium within the blood, which then prevents the blood from clotting. This tube is going to produce plasma, and that is what they're going to test for the clotting factors. Certain tests, common ones, I'm not going to name them all, there's too many to name, but common tests for this would be PT, prothrombin time, PTT, partial thromboplastin time, stay with me, APTT, activated partial thromboplastin time, INRs, international normalized ratios, and so forth. So again, this is a very, very common tube that you're going to use on a daily basis. Again, I named off some of the scenarios that you'll see this with. Okay, so we had our light blue tube. Next in the order draw is going to be our red. With the red, we have two different types. We have glass, we have our plastic. So with the glass, this contains no additive. So I usually ask people, well, how many times do I need to invert this particular tube? The answer is 0. Because the only reason we invert our tubes is to mix the chemical additive with the blood so it can do what it's going to do. And there's no need for this one. So this particular tube, the glass, there's no chemical additive. With the red glass, because there's no additive, this is going to go off It's going to produce serum. That comes from a clot. This is going to go off to either blood banking or serology. They can use this for antibody testing. I think back in the day we kind of used it for like blood typing. The majority of the time now they use a new tube, or somewhat new tube called the pink tube, which I'll get to. But this tube is, again, used in those type of scenarios. We have our plastic tube. With the plastic tube, this does have an additive. It's a clot activator. You can tell because not only that it's plastic, but if you look closely onto the tube, there's a little spray in here. It almost looks like a dirty dish you got out of the dishwasher. You use Sun instead of Cascade. There's spots on it, but it's actually a chemical sprayed onto there, in which then again we have to invert, mix up so it can do what it's going to do, which is also coagulate, clot, produce serum. This particular tube is going to go off to serology or chemistry. Depends upon what they're testing. So it's kind of vague, but again, you'll know where it needs to go depending upon the test that they request. With this red plastic, common tests would be like for digoxin, which is taken medication you take for heart. It also can be used for cold agglutinin tests. So that particular tube test needs to be warmed or pre-warmed tube. Once you collect it, then it needs to be maintained warm. I know it said cold, but you can do the opposite, because the testing part, they do it when it's cold, but initially when they get it, they want it to be in its natural state. So we want the blood to feel like it's still within our blood vessel, within the lumina of the vein, and be able to drop it off in its same state. This tube could take anywhere from 30 to 45 minutes to coagulate. This one can take up to an hour. It depends on the person's health, their medications, and so forth. Okay, after the red, the blood culture, light blue, are reds. We have a thing called the SST, the serum separation tubes. First and foremost we have is our tiger top, very common or very famous one, the red-gray. Then we also have a gold top. A lot of people mistake this for yellow, but it's gold. What separates this for be called an SST is this gel at the bottom of this tube. This gel actually separates the blood cells. So the blood will go into here, we invert it, coagulates, we centrifuge it, which a centrifuge does is spins the sample at a very high speed, separating blood components based on density. What does that mean? Heavier elements go to the bottom, leaving the liquid or lighter portions on top for testing. So it permanently separates the cells so they cannot reattach. They like this tube. Easy to work with, friendly, user-friendly. The difference between these two is cost. This one comes in more variety of different sizes. A bigger one, this size, and a smaller size. This one has this size and then maybe one other size. This is a lot cheaper to work with because it has the rubber stopper. This one has a rubber stopper, but it's enclosed by a Hemogard closure here, which for us, it's easier to work with. But really, they do the exact same thing. With this SST, the chemical additive in here is mild thrombin, promotes clotting. Our platelets that promote clotting are called thrombocytes. This is kind of like a chemical platelet. So it's going to help promote clotting at a faster pace. We're looking at this tube to clot within 15 to 30 minutes. Again, depends on the person's medications and age and so forth, but about 15 minutes-ish. So we went from potentially an hour down to 15 minutes. We also have other SSTs of other colors that can clot in 5 minutes. So it's like thrombin on steroids or a platelet on steroids. It's going to clot within 5 minutes. That would be more of an emergency room, some situation where we need it stat, short turnaround time, we need it immediately right away. That's where that would come in. This is more the common one where you don't need it quite right away, where it can take a little bit of time before they have to process it or test. Certain tests with this one I would go with would be like a CMP, Comprehensive Metabolic Panel, BMP, Basic Metabolic Panel. We could also go with a lipid panel, that's checking cholesterol and so forth. What other common tests? HIV, hepatitis B, bilirubin. So bilirubin is mainly like for babies, or most people associate with babies, where you have to have the amber shielded little tubes to protect it from light. This is when someone has jaundice, yellowing of the skin. With adults, because maybe liver failure, what have you, we draw the tube and we have to make sure we protect it from the light. You can either use tinfoil, Coban, or amber shielded tubes for this type of testing. Next in our order of draw, and again, the only tube that needs to be filled up to a certain ratio, that's vital, is the light blue. The remainder of the tubes have their volume that they want, but if it's a slightly short, say if you use that butterfly, that wing infusion, it came up slightly short, you'd be okay, good to go. Next in our order of draw is going to be our greens. Greens are, to me, I always think heparin. I think of shamrocks, football field, and I think of heparin. You'll get like this too. So with the greens, we have, try to stay with me on this one, we have 4 different types. We have a light green, and then we have 3 dark greens. They have different chemical additives. They have a common thing called heparin in them, different types of salts or different types of heparin. I'm going to go with the light green first. This light green has a common denominator that you just saw from our SST tube, has a gel. So with this one, this heparin tube is actually going to produce plasma. So we call this tube the plasma separation tube. Again, probably the most common tube out of the greens because again, that gel is worker friendly. So with the light green, we have lithium heparin inside of it. This tube is, again, one of the most common tubes of the greens. You can invert it, same as you normally would. The other 3 are going to be no gel at all. So these are just going to be 3 empty cylinders without the gel, but heparin with different types of heparin. We have sodium heparin, ammonium heparin, and then repetitive lithium heparin again, but no gel. Why are there so many different ones? Because of the different testing they do. These tubes are all going to produce plasma. They're going to go off to chemistry. With these particular tubes, why there's different ones is these 2 tubes test for lithium levels. So if someone's on medication lithium, what we want to make sure we don't do is grab the tube with lithium in it because it's going to be their levels plus what's in the tube, so you're not get an accurate reading. Someone's electrolytes, sodium levels. You don't want to grab the tube with, you guessed it, sodium, because that's going to be their levels plus more. Without not accurate. And then again, ammonia. We have ammonia in us. We're like a chemistry set. Ammonia in us, so they check your ammonia levels. We don't want to use the tube with ammonium because then it will throw off the testing. So different variety of tubes to work with. You won't have to decide. This is a physician's will, but you just have to make sure you select the correct tube. All chemical additives are written on the sides of the tubes. Also, expiration dates. That's also vital, making sure you don't grab expired tubes. That could affect the vacuum, and then obviously the amount you get, test results. With the green, again, cortisol levels, sodium levels, lithium levels, ammonia levels, and then also lactic acid. Lactic acid needs to be kept chilled or cold. We don't want to freeze it, but what we're going to do is get a cup with some chipped ice and water so we can set it in there and keep it nice and chilled until it gets to the lab. Also with the lactic acid comes from our muscles. So when we're looking for a vein and we're collecting blood, we use a thing called a tourniquet, the band they put around your arm. That tourniquet, if it's on tight or if it's even on, can release lactic acid from the muscles, which then can affect the test results. So when you're aware you're drawing for lactic acid, no tourniquet. So keep that in mind. Next in our order of draw is going to be our lavender, purple, lavender, whatever you want to float. So this tube is very common. This tube's additive is ethylene diamine tetric acidic acid. We call it EDTA, so chill out. So EDTA, and also has K2 and K3, potassium 2, potassium 3. K2 is a spray in the tube, K3 would be liquid, depending upon what they're requesting test-wise. The most common test for this would be a complete blood count, a CBC. You have the sniffles, you go to the doctors, they go to the lab to get some blood work. They're probably going to draw a lavender just because it's a good starting point to kind of see generically where you're at. Then they can go from there if something is off. So a complete blood count. This it binds calcium, prevents the blood from clotting, and up to this point, that you should be thinking plasma. Because they use all the blood when testing in hematology department, we call it whole blood. The other ones we test only the plasma and only the serum, so that's why I said yield those types of specimens. This one, they're actually going to test everything that's in the tube. So we refer to this as whole blood. Complete blood counts are the most common with this. Hemoglobin, hematocrit values, checking your iron levels, things like that, very common. We also have in this category, which would be our pink. I mentioned earlier kind of a newer tube, only because I've been doing it for so long, newer tube, but it's been around for a hot minute. The pink tube also has EDTA K2 in it, but this one is unique. This one can be used for blood banking. It can be used in hematology, but also can be used as blood banking to avoid us from having to use a glass tube and then waiting for the time frame of an hour. It speeds up the process. So awesome for the patient and for the testing and for results. What can we use for this one? Commonly, they will use it for RNH factors, ABO testing, which is like the blood typing, making sure like a pregnant woman, make sure her and the baby are in sync with the factors. RH factor is like negative or positive. So you have your, I'm blood type O. Well, is it negative or positive? So this will help determine that. After this, we have, and there again, this is the generic order of draw. There are other tubes out there, and I'll briefly touch on another one. We have our gray tube. The gray tube has sodium fluoride with potassium oxalate. So each chemical additive is either going to be a spray, liquid, or powder. This one just happens to be a powder. You're not going to be able to probably see it on camera, but it's a little bit of a powder. Same thing, make sure we invert it the right amount of time so it can do what it needs to do. With the gray, this is going to produce plasma. This is also going to go off to chemistry department. The types of testing commonly associated with this: GT glucose testing, GTT glucose tolerance tests, FBS fasting blood sugars, and then also alcohol levels to make sure, you know, like a DUI or what have you. So alcohol levels are also checked in here. If you are doing for alcohol, keep in mind, one thing you make sure you do is do not clean it with, you guessed it, alcohol, because that could throw off the test results and so forth. So what can we use as an alternative? Even if someone's allergic to alcohol, what can you use as an alternative for cleaning the sites? Soap and water, benzalkonium chloride, the ChloraPrep, all these different things out there to help assist you. The main thing is we don't want them getting an infection. But you definitely cannot use alcohol for the alcohol testing. We also have some random ones I'm going to throw out there is we have Royal Top dark blue. These Royal Top dark blues are commonly used for metals. So like checking someone to see if they're not toxic with mercury. So we also could have heavy metals, lead, and so forth. So these would help use for checking for toxicology type of testing. It can either go to chemistry or toxicology department. Now, where would these go in the order of draw? With these, each particular tube has, actually the additives are written on the tubes. So they're repetitive additives. This particular one I'm going to hold up has a red label. This, all it has is a clot activator. So where in the order of draw would this go? If you had it with another tube, you would put it in the slot with the red tube because it has a clot activator. So if you had it with other tubes. This particular royal blue has a lavender label, and this has EDTA in it. And we just spoke about that one. EDTA is in our lavender and our pink. So if I had a lavender or pink and I had this, I would put it right after. So it would go in that same slot as a lavender or EDTA. Because the order of draw is not really based on the colors, it is based upon the chemical additive. That is the rules we follow. Again, to avoid cross-contamination. Now that you got that down as far as the order of draw, now I like to mix it up a little. When we go to the dermals, capillary punctures, we use little bullets, typically on babies or children under 2 years of age, can be used for adults. But with these, we have a different order of draw. Trust me, it's simplified. We always start off with lavender, plasma tube after, which would be like a green or something, whatever it yielded, and then serum tube last. Most likely you only have one to fill up, unlikely you're going to have 3 of them to fill up. But if you do, you want to make sure you collect them in that order. The purpose or reason for that is when we poke someone with a lancet, the blood drips out, it's starting to coagulate or clot. So the first tube I use, I want to make sure I use a tube that's the blood cannot clot to collect. And if I have to my third tube, if I'm collecting a tube that it's okay for it to clot, produce serum, then that's why that would go in there. To collect that, you use a lancet. This particular one is for a finger. This particular one is for an infant's heel. The difference, this one goes a little deeper, not as wide of a cut. This one doesn't go as deep because we don't want to hit the calcaneus heel bone on the babies. But it gives a wider cut, as you can tell from the slit right here, which increases the blood flow. So that's our basic order of draw. Tune in for more. Thank you for your time. Hope to see you soon. Thank you.